Hey guys, welcome and welcome back to my channel. Hope you all are doing great. This is Dr. Prasanjit and you are watching Prasu'S Medledge series. So without wasting any time, let's get into today's topic. So guys, today I'm going to do an active recall session of the topic gastroesophageal reflux disease. So if you have already read this topic or have watched my previous video in which I have taught you about gastroesophageal reflux disease, then you can immediately jump into this video. Or else, if you don't know about this topic or if you are seeing this topic for the first time, then I will be providing you the link of the video, that is gastroesophageal reflux disease tutorial, on the I button. Just click on the I button and go to that video, learn it, or you can also learn it from any of the books you are having and then come back to this session so as to make this session beneficial for you. Now without wasting any time further, let's get into today's active recall session on gastroesophageal reflux disease. So first I will be reading out the questions. When I am reading the questions, I would like you to recall the points which you have heard about gastroesophageal reflux disease and try to extract it out from your memory. And once I am done with reading the questions, then we will take one by one each question and we will try to solve those questions, and let's see if we can get all those questions correct. Once I read it for one time, then you will have to just pause the video, just think for some time, and then you can try answering the questions. So here we go. First question is, define gastroesophageal reflux disease, or what we can say, what is gastroesophageal reflux disease. Then we have, what occurs when the mucosal defense is unable to counteract the damage produced by the reflux acid in gastroesophageal reflux disease. In long-standing esophagitis, the lower esophageal mucosa changes from dash to dash type. Columnar type lower esophageal mucosa is called as. Name the important mechanisms preventing reflux esophagitis. What is lower esophageal sphincter? Name the angle formed between esophagus and stomach due to the oblique entry of esophagus into stomach. Name one factor that reinforces the lower esophageal sphincter tone. What is sliding hiatus hernia? What are the two factors in sliding hiatus hernia that facilitates gastroesophageal reflux? Name the factors that reduce the efficiency of lower esophageal sphincter. Name the factors responsible for increasing intra-abdominal pressure and hence leading to gastroesophageal reflux. Name the factors that cause gastroesophageal reflux by increasing the gastric content available for reflux. Name a bacteria which can either inhibit or exacerbate acid reflux. What are the clinical features of gastroesophageal reflux disease? What is pyrosis or heartburn? In which position heartburn gets relieved? What is odynophagia? Transient dysphagia to solids in gastroesophageal reflux disease occurs due to. Persistent dysphagia to solids in gastroesophageal reflux disease occurs due to. Name some extraesophageal symptoms in gastroesophageal reflux disease. What are the complications of gastroesophageal reflux disease? Name few alarming symptoms in gastroesophageal reflux disease. Name the investigations to be done in a case of gastroesophageal reflux disease. Strictures and esophagitis can be visualized by. Esophagitis and Barrett's mucosa can be confirmed by. Hiatus hernia can be revealed by which radiological investigation? What does ambulatory esophageal pH metry reveals in a case of gastroesophageal reflux disease? What is the treatment for gastroesophageal reflux disease? What are the general measures to be taken in a case of gastroesophageal reflux disease? Name the drugs which are used in the medical management of gastroesophageal reflux disease. Why is blood transfusion indicated in some cases of gastroesophageal reflux disease? What is the surgical treatment of gastroesophageal reflux disease? What is fundoplication? So I have read all the 34 questions. Now just pause the video for some time and just think about the answers. So guys, first question is gastroesophageal reflux disease. So gastroesophageal reflux disease is basically defined as the complications which is resulting from the reflux of gastric contents into esophagus. Next question is, what occurs when the mucosal defense is unable to counteract the damage produced by reflux acid. So the answer will be reflux esophagitis. In long-standing esophagitis, we know that the lower esophageal mucosa changes from squamous type to columnar type, and this columnar type of lower esophageal mucosa is called as Barrett's mucosa. Next is name the important mechanisms preventing reflux esophagitis. So it includes various factors. First is lower esophageal sphincter tone, then intra-abdominal pressure which reinforces lower esophageal sphincter. Then we have oblique entry of esophagus into the stomach, and then the swallowed saliva which neutralizes the refluxed acid. So lower esophageal sphincter is basically a tonically contracted circular smooth muscle at the distal end of the esophagus, and the angle which is formed by the esophagus and the stomach is called as angle of His, which I have already discussed. One factor that reinforces lower esophageal sphincter tone, that is intra-abdominal pressure. Now, what is sliding hiatus hernia? Sliding hiatus hernia is basically a type of hernia in which the esophagogastric junction slides up through the diaphragm and enters into the thorax. Now, coming to the next question, that is the two factors in sliding hiatus hernia that facilitates gastroesophageal reflux. First one is loss of obliquity of entry of esophagus into the stomach, and the second one is loss of reinforcing effect of intra-abdominal pressure on the lower esophageal sphincter, because the esophagus and the upper part of the stomach is now in the thorax. Now, coming to the factors that reduce the efficiency of lower esophageal sphincter, it includes vagotomy, cigarette smoking, alcohol. Then we have drugs like beta agonists and calcium channel blockers. Then the factors which are responsible for increasing the intra-abdominal pressure and hence leading to gastroesophageal reflux disease. So this is something which increases the pressure within the abdomen. So it can be either ascites, weight lifting or straining, then obesity, pregnancy, etc. Next is the factors that cause gastroesophageal reflux disease by increasing the gastric content available for reflux. So basically the content volume should be more. So large volume meals is one such case in which gastroesophageal reflux occurs because of increased gastric content. Also, if there is impaired gastric emptying due to some gastric outlet obstruction, this will also lead to gastroesophageal reflux disease due to increased gastric content. Name a bacteria which can either inhibit or exacerbate acid reflux. So it is Helicobacter pylori, as you all know. Coming to the clinical features of gastroesophageal reflux disease, we know all the clinical features. First is heartburn, that is also called as pyrosis. So basically heartburn is a deep burning pain behind the sternum which is radiating to the throat. Okay, and the next question is what is heartburn. So I have already mentioned what is heartburn, and in position in which the heartburn gets relieved is basically by sitting up. And odynophagia is also the second symptom seen in gastroesophageal reflux disease, which means painful swallowing. Apart from that, we also get transient dysphagia to solids in gastroesophageal reflux disease, and that is due to esophageal spasm. Next, we have persistent dysphagia to solids in gastroesophageal reflux disease, that is due to strictures. Some of the extraesophageal symptoms of gastroesophageal reflux disease includes hoarseness of voice, then chronic cough, sore throat, and recurrent aspiration. Recurrent aspiration is very important complication also. Now coming to the complications of gastroesophageal reflux disease, so we will think first the acid goes into the stomach, right? So it can cause reflux esophagitis and it can lead to esophageal ulcer. Because of esophageal ulcer there can be bleeding, so it can lead to iron deficiency anemia due to the blood loss. Then also it can lead to formation of carcinoma of the esophagus, and there is Barrett's esophagus also. Apart from that, because of recurrent aspiration there can be aspiration pneumonia also. Now coming to the alarming symptoms in gastroesophageal reflux disease. So what are the alarming symptoms? First we have to think if there is any GI bleeding, then weight loss, and then there can be nausea and vomiting. What are the investigations to be done in a case of gastroesophageal reflux disease? So to view the lesion we have to do endoscopy. So strictures and esophagitis can be visualized by endoscopy, and once we do the endoscopy we take the sample and we confirm whether it is esophagitis or not by biopsy. That is what is called as biopsy. And hiatus hernia, it can be revealed by which radiological investigation? So this is basically barium swallow and meal. And the last investigation is ambulatory esophageal pH metry. So the question is, what does ambulatory esophageal pH metry reveals in a case of gastroesophageal reflux disease? So it will reveal a sudden decrease in intraesophageal pH. Now coming to the treatment for gastroesophageal reflux disease, so we basically have general measures, medical treatment and surgical treatment. So the next question is the general measures. So basically we have to do weight reduction, cessation of smoking, take small and frequent meals, avoid alcohol, caffeine, late night meals, and avoid weightlifting and straining. Then medical treatment includes proton pump inhibitor. Then we can also use H2 receptor antagonists like ranitidine, proton pump inhibitor like omeprazole, pantoprazole. Then we can use liquid antacid, and we can also use metoclopramide. Why is blood transfusion indicated in some cases of gastroesophageal reflux disease? Blood transfusion is indicated in some cases of gastroesophageal reflux disease because due to the gastrointestinal bleeding, sometimes there can be excessive blood loss and this leads to iron deficiency anemia. So for correcting that, we can do blood transfusion. Surgical treatment of gastroesophageal reflux disease is basically to treat the strictures and also to bring the lower esophageal sphincter back into the abdomen. And there is a procedure called as fundoplication, in which the upper part of the stomach, that is basically the fundus, is wrapped around the esophagus to form a tunnel like thing around the esophagus, and this also helps in preventing gastroesophageal reflux disease. So that is the answer for the last question, that is what is fundoplication. So with this we end this recall session. I hope you liked it. If you like my content, please do like, share, subscribe, comment, and also press the bell icon to get notified whenever I post a new video. And see you in the next video, guys. Thank you.